This topic is trauma across the lifespan, what we know. And what I'll do is I'll just introduce Dr. Larke Huang, who will then introduce her other panelist members. And Dr. Huang earned her PhD as licensed clinical community psychologist from Yale University, is a senior advisor on the children to the administrator of SAMHSA. She provides leadership on national policy for mental health and substance abuse use for children, adolescents, and families. She is the agency lead on cultural competence and eliminating disparities. She is currently on a 6-month leadership exchange at the Centers for Disease Control and Prevention, what we commonly call CDC, where she is a senior advisor on mental health. Dr. Huang has worked at the interface of practice, research, and policy, and in leadership roles dedicated to improving the lives of children, families, and communities. I'd like to welcome Dr. Huang.
Okay, well, good afternoon and welcome back from lunch, and thank you, Fran. It's a little bit of an older biography on me. I'm not sure where you got that one, but I'm no longer detailing at CDC, and my roles at SAMHSA have changed a little bit, and I have the honor of leading one of the administrator's strategic initiatives. I lead the initiative on trauma and justice, and that's what this panel is going to be addressing today. I also direct our new Office of Behavioral Health Equity, which looks at disparities issues in behavioral health, which was mandated to be created by the Affordable Care Act. So I welcome you this afternoon. We have a very exciting panel. We are a little bit behind time, but if it's okay with the planners, I'm not going to actually cut back on our presenters' comments. I'll actually probably just cut back a little bit on my own. I want to share a little bit about our strategic initiative on trauma and justice. The purpose of this initiative, again, we have 8 of these initiatives at SAMHSA. This is our sort of number 2 initiative. The focus of this one is to reduce the pervasive, harmful, and costly health impact of violence and trauma by integrating trauma-informed care, trauma-informed approaches, trauma-specific interventions throughout health, behavioral health, and other related systems, not just within behavioral health, but other systems where we know there's a relatively high prevalence of people with histories of trauma. And to also address the behavioral health needs of people involved in, or in Marvin's favorite phrase, at risk of involvement in the criminal and the juvenile justice systems, where we know we have a high prevalence of people with behavioral health issues as well as people with significant trauma histories. These are our 5 key goals of the strategic initiative. You'll see that we are trying to develop a comprehensive public health approach to trauma, where we're looking at surveillance issues, we're looking at building awareness of the role of trauma in people's lives and how it connects with not only behavioral health issues, but other physical chronic health diseases, to make screening for trauma and early intervention and treatment common practice, again, not just in behavioral health systems, but in other service systems, such as primary care, which you'll hear about today also, or child welfare, or criminal and juvenile justice. To reduce the impact of trauma and violence on children, youth, and families, we've had major work in this area, particularly around our National Center for National Child Traumatic Stress Network, and then moving some of that work out again beyond just behavioral health into other systems that are also serving children and families. To address the needs of people with mental and substance use disorders in the criminal and juvenile justice system, and reduce the impact of disasters on the behavioral health of individuals, families, and communities. We take a broad definition and a broad approach to defining trauma, which you see on the screen. I'm not going to read through that. And what we look at is terms of the trauma responses to these kinds of traumatic events. Some of the key facts. We know that trauma is strongly associated with mental and substance use disorders. 43 to 80% of individuals in psychiatric hospitals have experienced physical or sexual abuse. About a quarter of state prisoners and jail inmates with mental health problems also reported past physical or sexual abuse. And we know that on an annual basis, and in 2008, about 772,000 children were victims of maltreatment. Among U.S. youth, we know that about 60% are exposed to violence within the past year, and 8% report lifetime prevalence of sexual assault. 17% report physical assault. Nearly 40% report witnessing violence. We know that childhood traumas explain about 32% of psychiatric disorders in childhood. So in our work, we are increasingly understanding the centrality of trauma to mental and substance use issues. And we want to know how we can more systematically address this in our work, whether it's in our grants, our contracts, our initiatives, or in the types of leadership we provide or the leadership we're involved in collaborating with and developing. So our panel this afternoon will highlight the impact of trauma across the lifespan. We want to provide an understanding of trauma and trauma-informed care, what the research supports, and how the research and life experiences of trauma survivors can inform policy and practice. I think we're going to be kind of recapitulating what we heard from in the morning keynote around the importance of the narrative and the importance of understanding the data and the policy and how we put this into practice. I'm very honored to moderate this panel of truly inspirational experts in trauma and leaders nationally, and I'm going to introduce them all at once now in the order in which they'll be presenting. Tonira Kane, our first presenter, is a consumer advocate and a team leader for the SAMHSA-funded National Center for Trauma-Informed Care, which provides consultation, technical assistance, and training to change the way mental health, behavioral health, addiction, and human services are organized, delivered, and managed through a trauma-informed approach. She is a nationally recognized speaker on trauma, incarceration, and recovery. Alicia Lieberman is the Irving Harris Endowed Chair of Infant Mental Health, a professor and vice chair for academic affairs at the University of California, San Francisco Department of Psychiatry, and director of the Child Trauma Research Program at the San Francisco General Hospital. She directs the SAMHSA-funded early trauma treatment network of the National Child Traumatic Stress Network. The mission is to increase access and raise the standard of care for traumatized children, families, and communities across the country. She is also a recognized international expert, and I'm proud to say that when she was just launching her work at the General Hospital, I was working here in San Francisco at that time, and so I had the opportunity to know and work with her then. Valerie Edwards is a research psychologist in the Emerging Investigations Branch at the Center for Disease Control and Prevention. For the past 10 years, she has worked on the Adverse Childhood Experiences Research Team. This is a landmark study that provides much of the foundation for the correlation between childhood trauma and later chronic physical diseases and behavioral health problems in adulthood. And finally, Nadine Burke-Harris is the founding physician and medical director of the Bayview Child Health Center, a community-based satellite clinic of the California Pacific Medical Center here, also in San Francisco. She's a board-certified pediatrician with a master's degree in public health, and her areas of focus are health disparities, child trauma, asthma and nutrition, and developing services in communities where poverty and race present challenges to conventional health care and education. Her mission is to improve health outcomes through innovative approaches that integrate medical, social, and mental health services.